Hello and welcome everybody to this EMSA webinar. As you may know, this webinar has been organized by the European Medical Students Association, which is a non-profit, non-governmental organization representing medical students from all across Europe. EMSA is recognized by the European Parliament, the European Commission and the World Health Organization. The association provides a platform for high-level advocacy, projects, trainings, workshops, and international meetings. And as you could see in the invitation, this webinar has been organized by the medical education pillar. Unfortunately, they couldn't be here, but I'm taking their place for now. My name is Jordan Kovacev. I'm the EMSA Vice President for Internal Affairs. I will introduce to you now Dr. Paul De Roos, who will lead this webinar. Now it is time to introduce him to you. He's a neurology specialist working in Sweden and an EMSA alumni. He was the Medical Education Pillar Director for the term 2005-2006. He attended 13 AMEE conferences and contributed to a lot of AMEE Postgraduate Training Committee during his residency. He has been actively engaged in different phases of education so far, and today he is with us to talk about how to measure our progress from being a medical student to a competent specialist. You can ask questions after his speech. Hope you enjoyed this time, and let's get started. This is Dr. Paul De Roos.
Hello, good evening. Welcome to this EMSA webinar. I highly appreciated that I got the invitation of EMSA to lead this session tonight, and I will do my best to make it an interactive session. So with that, I'm gonna go over soon to a screen share, and then that's what you'll be seeing instead of my face, which I assume will be more interesting as I will, well, show some data and some interesting stuff on the slides. So right now I will start the screen share, and then we will move on from there. Share. All right. So the screen share is on. Good evening. Right now, this webinar I'm doing, I'm hosting it from St. Petersburg in Russia. Normally I live in Sweden, and in the introduction, my colleague Jordan said that I am neurology specialist, but that's not quite true yet. I'm soon graduating my specialist training program. So I am now going to take you through the agenda of tonight's meeting. Agenda is about the topic, why the topic was chosen, and this is the introduction. I'll take around max 5 minutes for it. Then we'll continue on setting learning objectives, and I want to get to know you, who is listening. And from there on, we will move to the topic self-reflection and self-awareness. And after that, we start thinking about this topic as an educator, which means technical medical education terms will be used, and we will start looking at the literature. I expect the take-home message to be approximately that thinking like an educator can help you with measuring your own progress, and hopefully this webinar will give you some insights and ideas for further discussion if you're active in your faculty discussing with the medical education staff and leadership the topic of changing education, curriculum reform, or when you look at assessment. So I hope this is practical both when you're student representative as for you as individual students going on through your own path through the medical curriculum. As I promised, this session would be interactive, and I suggest that you open a separate tab next to the Google Hangouts tab, or that you open Google Chrome or another browser on your cell phone, and then go to the website www.menti.com. And if you enter the code 426954, as is shown at the top of the screen, this gives you the chance to give some input in tonight's session. So you'll get a chance to say in some keywords what it is that you want to learn. So you open a tab, go to menti.com, and type the code 426954. And then you can enter some keywords, stuff that you would like to share. It will show up on this screen in the Google Hangout as a Wordle. So I'll give you like 30 seconds to see if you want to enter some IDs. All right. So first keywords are coming in. So as I said, you can open a separate browser tab, or you can open a tab in the browser on your cell phone. And after you enter the words, you can join me back in the Hangout screen. All right, we have 4 answers already. 5. Thank you. Keep them coming. 6, 7. Exciting visuals. 8. So just so you know that Jordan is, in meanwhile, also monitoring our chat. So on the end of my presentation, there will be possibility to add questions. So both on YouTube and on the Hangouts link, you'll be able to leave comments and ask questions, and we'll deal with them in the end of this presentation. So some of the keywords I see on the screen: evaluation, progress, developing empathy, self-awareness, opportunities, emergency, medicine specialty, I think EM stands for that, collaboration, self-evaluation, self-reflection. Self-awareness. It's a nice amount of keywords to work with. I will try to make sure that these keywords will also pass by in the presentation. All right, I'll go to the next slide. I'm going to ask again from you to give me a little input on who you are. How long have you been studying? So yeah, let them come. So I have some idea on who you are. It's nice to see the learning curve. This time the voting goes way faster than before. So we have a nice spread of all years of the medical curriculum almost there. There's no typical EMSA alumni there that have spent more than 6 years studying and are still part of webinars and EMSA activities. So we got 10 people. It's spread over the whole curriculum, which also means that some of you may have a lot of patient contact, some of you may not have that yet. And of course, I'm going to ask about that too in the next question. But I want to make sure that what I'm going to tell you tonight is relevant for all phases of the study. So this is why I asked the question. All right. We have 11 votes, 12 votes. So there's still new people coming in. Also, the people coming a bit late, I would like to welcome. I'm going to go to the next question before I start talking. Do you see patients regularly? It's almost 50-50. All right. So there's slightly more people that don't have regular patient contact in the conversation. All right. Well, if we look back, I think there is some logic to it, but there also means that some curricula or some of the people here are in later stages of their study, yet still don't have that much patient contact yet. All right. So that's important perspective. All right, let's move on from here. Thank you for the active engagement. Next thing I'm going to ask, I'm going to introduce a little bit of theory soon. Who of you is familiar with the Johari window? sure you can Google it, but I can talk a little bit about it as well. All right. Seems they haven't been teaching about that in medical curriculum, yet it's quite important. I'll go to the next slide and show you a little bit what it is. It's a classical theory of a psychologist, and it deals with what you know about yourself and what you don't know about yourself, and what others know about you and what others don't know about you. So there's 4 quadrants, and if you look at the bottom left, what is known to you but not known to others, that's a bit that you haven't exposed to the world around you yet. For example, you can think of all the knowledge that you have gained through all the theoretical exams, but the individuals you meet in the clinic don't know what you can do. Maybe only the course administrators of the courses that you've been through. What is known to you and known to others, well, if you just pass the exam, others know that you have a specific level of knowledge on a specific topic that you just did an exam in. And, well, they gave you a grade, so they know what it is about, and you know your own knowledge too. You know if you had blunt luck passing the test. You know if you were just gambling the whole test through, if it was multiple choice. You know if you really knew it. And others have an idea of what it is you know. But there's also an area not known to you that is yet known by others. And this happens, for example, when you interact with other people. So this is usually not the pen and paper bit, but this is how people see how you interact. So when we talk about this topic, measuring progress from where you're at as a medical student to becoming a doctor, all these areas are of relevance. And if you think of a typical scenario, you just got your medical degree and you passed all the tests, you may have been the best in your class. And then you may think you know a lot because you have been always the best. This is basically the most dangerous young doctor there is, because that doctor is confident and may not know what he doesn't know. And there may be stuff hidden that was not in the textbook that actually matters a lot in everyday practice. So we have a lot of countries in Europe that basically give this false sense of confidence, because to be able to be a medical student in many countries means being the best of the class. And then knowing what you don't know is like a key element in being safe as a young professional. So both knowing what you know and knowing what you don't know are key elements of professionalism in the young professional. And knowing when to ask help, but also expanding this view on yourself. So it is a fact, there is stuff you don't know about yourself. And you have to actively look for it to find it out. So give it a thought for yourself. How would you find out about stuff about you that you're not aware of yourself? And think of what type of methods can be used for that. Now, the medical curriculum and clinical practice have lots of possibilities to actually find out about these things. And even your specialist training when you come later in your career. So to go back to one of the topics, for example, mentioned empathy, you may be thinking that you're really good at it, and you may actually be, but you also may not be. And this you only will find out in interaction with people. And you also may find out that sometimes you're really good at it, sometimes you're not, and then which circumstances. So to know whether you make progress, you need to be able to anchor your experiences and your knowledge in reality. And there are different ways to go about it that medical educators tend to use. So this was a bit of theory about the Johari window, and it's a very useful concept for self-exploration. Next thing, when we think of medical education, there is different ways to go about defining what progress looks like. And in a typical curriculum, you'll see that every course has learning objectives or learning outcomes formulated. And in some countries in Europe, you'll see that they write down competencies. and even fewer countries, you'll see that there is a concept called entrustable professional activities. So how do these different words relate to each other? I think that that's an important topic to dig a little bit deeper into. You could say that learning objectives, you need several of them to define one learning outcome. So to be able to, for example, achieve proper communication with a patient on a specific topic, you could say you need to know or be able to do certain other things. So you need to have some knowledge, you need to have some skills, and maybe there's an attitude as well. So there are different components that will define whether you're able to communicate about a specific topic. But to say this person is a competent communicator, you may need a lot of learning outcomes to actually reach that goal. And to be a competent communicator in specific contexts, in context without proper supervision, that's where you can say we talk about entrustable professional activity level of abstraction. So basically, you go from learning objectives, like the smallest item, to entrustable professional activities as a more overarching concept. And entrustable professional activities, they are usually very few and high level, and learning objectives, they can be many. So if you would break down your medical curriculum into learning objectives, you can go to course level and then break down the course in many learning objectives. And then there's some outcomes that need to be achieved. So, and a bunch of those outcomes clustered together can be described as a competency. And then the competencies together, you can formulate as entrustable professional activities. So there's some kind of a hierarchy in this, and I will dig a little bit deeper into it. But first, a question. Which of the following do you think your medical school uses? Learning objectives, learning outcomes, competencies, and entrustable professional activities. And your answers that you can now hand in will depend a lot on where you're from and where you live. And while you guys fill in the questionnaire, I will say at the end of this presentation, you will get my slides, and you'll also get a handout with a reading list. So on this reading list, you can have access to quite a lot of hyperlinks to papers on all these topics that I'm sharing with you. So this allows you to develop your background knowledge on different ways to write down about learning and where you're heading next, what you're able to do, what you're able to understand, what you know. Nice. We have entrustable professional activities too on the list. So I can say this topic has been evolving in the last like 5-6 years, maybe 8, 9, but the reason why I took up this topic is because it was very dominant, very prevalent at the last AMEE Congress. AMEE stands for Association of Medical Education Europe, and it's an international association for medical education. So one of the reasons why I proposed to do a webinar today about this topic was because for me, it presented a logical next step. When I was graduating or working towards graduation, I graduated in 2009, competency-based education was a big thing in the Netherlands. I graduated in Amsterdam, and since then the educators and leaders in medical education have moved on. But yeah, the Netherlands is a different story, and I also know, for example, in Germany they also do a lot with entrustable professional activities, also in undergraduate training. But as I also see, most of you, they get exposed to learning objectives. So for you, I think, or I hope really that it's interesting and yeah, important to know that there's different ways to think about learning. And tonight I will tell a little bit more about entrustable professional activities, because they really can guide your way in how much of a doctor you are yet. And that's very nice for reflection, but also for your own progress to become the doctor you want to be. Thank you for all the votes. I will move on to the next slide. So if you look at the way medical education is organized in most countries in Europe, there are on the national level regulators that say, well, when you graduate the medical school, you will be able to do this, this, and this, and this. So this is a regulatory framework. And depending on which country you are in, this will be defined in learning outcomes or competencies. And in some places, they may even have phrased them in entrustable professional activities. But undergraduate level, I think learning outcomes and competencies are most prevalent. And learning objectives are also still there, but that's maybe on course level. So to look at the postgraduate training, that's the specialist training, their entrustable professional activities are becoming more and more widespread. I think in Canada and in the United States, but also, for example, in the Netherlands, there is a lot of work done on this topic. But the concept by itself can be usable for medical education as well, for undergraduates for the first 6 years. And this is also one of the reasons why I'd like you to think about it, because when you think about what can I do and what type of supervision do I need to be able to do it, can help you look for opportunities to actually learn how to do it. Can I do an intravenous function? Can I extract blood yet? Can I listen to the heart and make a proper hypothesis on what I hear and ask a proper question to the cardiologist? Can I do a clinical history already in a proper way? Is it complete? Does it include all the important things? And can I report about it to my supervisor? So being able to do these type of things can enable you to get competent on higher levels. So in order to first dig a little bit into, because I already saw you have learning objectives, but if you want to write down learning outcomes, there is a nice tool to look at this. And Bloom's taxonomy is the next bit of theory I'd like to raise and discuss. So you can feel free to let me know whether you know about this. It's helpful we still get over 10 votes. That means that you're still there. Thank you for not running away yet. I mean, I realize too, it's like after 7, it's a weekday, it's an evening, and you're listening to a webinar. Wow, we got 11. Hopeful. 12. All right. Well, let's dig a little bit into Bloom's taxonomy then. So Bloom's taxonomy is like a taxonomy. It's a hierarchy of different levels of knowledge and skills that you can attain through education. So if you do an exam, which is basically based on rote learning, for example, one of my own strategies for learning, and by no means I'm a role model there, for example, was using old exams. And we used to have multiple choice exams in Amsterdam, so I would make sure I had the last 5-6 years of exams and knew all the answers before the next one. And I knew the teachers were relatively lazy, so they would reuse at least 60% of the items. And then on the other part, they would make variations. So remembering the exam questions, not understanding, but remembering, is the lowest level of knowledge. Like I said, I didn't do this on all topics, but there were some topics that I really didn't like that, yeah, last minute studying, you know how that goes. Course is almost over and then you start. But then again, this is not best practice of studying. It's not the best way to actually recall everything. But I thought I knew what I needed to know and what would be useful for being a doctor. I can say I have not always been right there. Next level is understanding. So to understand the different items and in your exam, or how different topics relate to each other. Actually understanding the question, not merely knowing the answer if you would do multiple choice, or if you would do a question where you write essay answers, which is also common, or oral exams, which are also done in some countries. Their understanding is the next level they test. And then applying, here you could see like clinical skills exams. If you have a clinical training center where you do simulations, their applying is the next level of knowledge. For example, you do the ABC and you check if the patient's airways are free, if they breathing, or if they're stable, if the circulation is there. So yeah, that's basically these drills you do in this skills training center. And then analyzing, you could think of coming with a differential diagnosis. If you have some facts from a clinical examination and clinical history taking, and then you come up with hypotheses what the patient can have, and then you present the data to the specialist that supervises you. And if you go one step higher, you evaluate it and say, well, based upon those findings, I would actually do that. And creating, one can say, creating relevant learning materials about the levels below. So that's Bloom's taxonomy. And when you think about learning outcomes or learning objectives, usually they use specific words targeted at different levels in this taxonomy to make sure that in the way they phrase the course objectives, that you accomplish those course objectives when you're at the end of the course. However, this also depends on where you study, because from some course objectives, the goals are way more bold than what is actually tested when you do your exam. And another issue, of course, is when you do the exam, there is no guarantee that you actually have attained those goals, because how much can you trust the exam? So reality is that when you read the literature on assessment, that continuous testing and using different ways of testing can give the most reliable image on what you actually can do. And then there is also testing for seeing your own progress, but there is also testing that informs your learning. There is also testing that is done for accountability purposes, for external actors. For example, university versus society, that the society as a whole wants to be the guarantee that you're going to be a good doctor. So then the purpose of your testing could be to assure that everybody in your course has a minimum amount of knowledge, which may not correlate with how you will practice. And another reason for testing, of course, in many countries is the ranking exam. There you get ranked, and based upon the points you get freedom to choose what type of specialty you want to pursue. But of course, for helping you progress and helping you actually move forward within your own learning process, this may not make too much sense. So there's different ways to look at this Bloom's taxonomy, and it's important to realize that it's important for assessment and testing. All right, we move on. When you think of entrustable professional activities, the highest level of the complexity, you can think of those in different stages of your career. And if you think of a medical student, measuring and reporting blood pressure adequately could be an entrustable professional activity. There is a deal of trust needed, for example, that you will report the right measures, that you actually can do the right procedure, that you do the blood pressure measurement the way you're supposed to do, and that you're reliable in this. And then on a higher level, for example, when you do your clinical rotation, complete physical examination and history, and then reporting of it in a solid, consistent manner, and that you have a high quality of reporting consistently. This could also be an entrustable professional activity. So you see those circles, they are nested. They are inside each other. And then the highest level you see here, a senior resident running a regular outpatient clinic. And you can think of this entirely independently, or you can think of this under a certain level of supervision. So for purpose of understanding this, I share also different levels of supervision in this presentation. So when your supervisor is there to observe you, that's the lowest level of freedom. And then level 2 is act with direct proactive supervision, with the supervisor physically present in the room. And you can think here, as I work in neurology, the situation happens often with medical students that come on their rotation and they do their first lumbar puncture. So I stand right next to them and talk them through the process before. I help them with how to interact with the patient. I stand right beside them, and if there's any difficulty, I can take over at any given moment. And then level 3, act with indirect, reactive supervision, readily available on request. Here, I would not be in the same room, but in the room next door, for example, and then assist anyway. And then level 4, act with supervision not readily available, with distant supervision and oversight. So this is the situation I usually work in at night when I do my shift. Here I have to summarize adequately my findings of physical examination and of the clinical history, maybe of additional investigations like blood tests and imaging, and discuss with my supervisor, who will not be at the spot, but will support me in the decision making. So I have to propose my own decisions there too. And level 5 is provide supervision to junior trainees. This level you reach usually, well, depending on the type of activity. Like for example, in the shifts at night, you're a specialist when you are allowed to supervise the juniors. But when it comes to a nursing ward where patients are admitted, you can be slightly more junior and also be engaged in supervising activities. And I think again here in terms of these nested entrustable professional activities. So supervising juniors for learning how to take blood pressures, or supervising an intern how to do a complete physical examination and history, I do quite a lot and quite often as a resident. So it's all relative there. All right. Then here is another slide on supervision and different ways to look about that. I must say there is a whole lot of different frameworks for this. I'm not going to go through this in detail. On the literature list, you will see, by the way, curriculum development for the workplace using entrustable professional activities, AMEE guide number 99. This one is not freely available, sadly, but the link to the website is included, and most likely through the university you'll have access to it if you're interested in looking into it. The relationship between entrustable professional activities and competencies can be shown in a matrix. I just gave an example as it was also written in the article. So several competencies will show up in several entrustable professional activities in different ways. So this type of matrix figure helps with planning an educational program. It helps with making decisions on how to assess. Next slide. Well, when you have entrustable professional activities, one needs to actually entrust you, or there needs to be a decision taken on if you can be trusted. And on the left side in this table, I know this table is not really nice for screen presentations, but in the left side you see factors that affect entrustment decisions and potential information sources. So when you think of assessment, there's different ways to test. And of course, this example that's given is very much focused on postgraduate training, but It doesn't mean that you cannot think about it in a similar way undergraduate education. But for example, competence in clinical reasoning can be found in knowledge exams and skills exams, direct observation by supervisors, and feedback from patients and peers, like multi-source feedback. So there's all types of different ways to observe whether you can be trusted in clinical reasoning and whether you reason well. And these type of sources, they can be used in different ways. So if you think about a really robust system of testing, one would say, well, there would be lots of testing moments. There would be lots of small snippets of information. It would be like continuous assessment, like feedback on how you function, how you do your job. If you think about it, it could be a painfully bureaucratic administrative process. And here you really need to find the right balance between testing and showing evidence and gathering evidence versus the actual learning. And I can give an example. There have been lots of experiments in medical education with portfolios where students reported back that the keeping of portfolios was so much work and gave so little benefit. Yet it could help with reflective practice. So there needs to be a balance between administrative burden put on students from the institution side and actually learning that is yielded from the methods used. So in this context, it's also important to think of testing that drives learning. For example, if you do a test and the test is not for you to pass or fail, but to inform you on how well you do for yourself, there we call this formative testing. So it's testing that informs your learning. My experience was that when I was a medical student, I got way too little of this. And most of my testing was summative. It was, well, targeted at, in the end, delivering a doctor, and the tests were just milestones to get me there. So there's a lot of stuff to think about here. If you think about your own personal development, what is it that you want to be able to do? What is it that you can grow in the next clinical placement you're in? What is it that you feel can give you something in current courses you do? You have the formal assessment that says, well, that course is done. No looking back. I can move on, and I'm a step closer to becoming a doctor. So passing exams definitely is a measure of progress. But do you have your own measures of progress? And here you can think of what is it that a doctor does in everyday life? What does a doctor need to be able to do? So when I was in medical school, the Canadian Medical Association, or the Royal College of Physicians and Surgeons, they published this document called CanMed about physician roles. And these type of documents with outlines of what physicians shall be able to do can really help you to look at what roles in yourself need further development. So for me, I felt I needed to learn how to work with people. So this was for me a reason to engage with student organization EMSA. Another reason was I don't like my medical education and I need to try to influence it. And the best way to do it is by learning as much as you can about it. So having read the articles and being able to discuss with the professors what I wanted to see improved was my method to contribute to improvement. So right now, I think I've come to the part of my presentation where I would like to open the floor for questions. But before going there and closing the presentation view off, so I'll be turning on my webcam afterwards, I will want to show one more question. And it's an evaluation question. I shared a lot of ideas with you today, and I would like you to think about how usable are those ideas and what possible impact can they have in your life. If you would take them on yourself, or if you would take them up on in a discussion with your educators. So think about the value of the concepts I've been talking about today, and to which extent they help you with reflection. If you think about literature, entrustable professional activities, or if you think about self-awareness, because if you're aware of all the learning objectives, or what is it that is in entrustable professional activities elsewhere in the world, what does it give you as a learner to help you measure your own progress? Well, so far, 3 people still awake. Curious about the rest. Oh, 4. I must say I haven't really dig deep into the self-awareness bit today. For me, the self-awareness or growing of it, the best way to do it is through interaction. So there you can create your own experiences and possibilities. Again, student organizations are really great for improving self-awareness. But on the other side, having a partner or intimate relationship with somebody helps with self-awareness a lot as well. Somebody that knows you really well, or within family if you have open communication. Of course, direct feedback can help you with self-awareness as well, or soliciting feedback. All right, we have 9 votes. We have more. Oh. Everything is in the same place. I'm happy that you guys feel positive about the topics that were discussed here, and that they have some kind of usability and some kind of possible impact. Interesting that assessment ranks lowest on possible impact. I bet it is because how it's used in practice in many curricula. But I'm curious to hear your reactions there. I'm going to close off the screen sharing bit, and my browser has crashed on that before. So in worst case, I need to re-log in really fast. But I'm going to close off presentation view right now. And Jordan, you can come in and start communicating if that helps. Then we don't have any problems here with continuing.
Hello, can you hear me?
Yes, I can.
So there are no questions so far, but I send out a feedback form also that people can give their emails. And we'll send all the follow-up documents to their emails afterwards. And also it includes a feedback form, so I'll share it with you also if you're interested to see that.
Yeah. Well, we can at least share in the chat if you want to the link to the handout.
Yes. I put them in the description, but I'll also share them in the chat now.
All right. Cool.
Just a second.
Well, I'm really happy that we got such active participation in the surveys. If we don't have questions right now, then at least we had active participation in the interactive bit there.
Yes. Sorry. Just to make sure, do you want to continue the webinar, or is there anything else you would like to add?
No, I don't have much more to add. I mean, there's so much one can go deeper into, and I'm prepared for difficult questions there. So I'd really love to encourage people to ask if they have any.
I'll just give a few more, maybe a couple of minutes for people to ask questions if they would like. But for now, you're just receiving thanks for the useful information and for your presentation. So I'll just give the participants another chance to ask questions. Just a couple of minutes, if that's okay with you.
Sure.
I'm sharing them. I'm sharing them the links right now.
Cool. And I'm grateful that they showed up and wanted to listen to what I had to tell. I think they can also write down if there's topics they want to know more about, because I scratched the surface on many topics tonight, and I can dig deeper in any of them. But yeah, I chose not to dig deeper just based upon the questions that were there and the feedback I got in the surveys. I tried to stay at the level and the focus that would be most relevant. But
we have
again,
actually. So I'll tell you the first one. If you could give some examples for competencies and entrustable professional activities.
Mm-hmm. Well, if I can open the slide that I shared, but entrustable professional activity. One example that I showed was, for example, doing the clinical examination and physical the medical history taking. Like, you can, depending on where you're at, like if you think of a medical student, those can be EPAs. For a medical specialist, they are way too small and narrow. So how do you define EPAs? There is quite a variation on how they are defined. The same with competencies. This is not an easy topic. Actually, the scientific community is not at all agreeing like there's one way to formulate. But if you think about it like this, as a medical student, there is a significant risk if you cannot do a proper physical examination, and if you cannot do a proper clinical history, and you will not have the right data from the patient, so you will not be able to get the right hypothesis, and with that you will not propose the right investigation, and that includes a risk. So what they tend to say of EPAs is that if you fail, there is a potential risk for the patient. So there is a level of trust needed for you to be able to do this with a specific level of supervision. So if the trust is really low, somebody needs to sit next to you and observe whether you do it right. If the trust is already a tiny bit higher, they trust your findings and they may double check some of them, like not all, but just double check some bits of what you did. And if the level of trust is already a bit higher again, it's the story you tell about your findings that is trusted. So, entrustable professional activities can mean different things on different levels of your study. But when you think of the real high level ones, when I refer back to the image that showed the nested circles, like run an outpatient clinic independently, that's a really high level EPA. And obviously there is different types of evidence that goes into readiness for that, then readiness to do a physical examination independently. But the idea behind this is, of course, that it is tested, that there is proof, that there's evidence. So it's also type of accountability to the public, that you actually are able to do these things. I hope this was a proper answer to the question.
Yes, thank you. I'll tell you the other question as well. Thank you for this answer. Could you maybe talk about your view on peer feedback?
Peer feedback?
Yes, this is the question.
Okay. So as I described before, for entrustment decisions, you need many type of evidence sources. But when it comes to learning and propelling your own learning forward, I think peer feedback can be really nice, as in finding out where you're at and where you're going. Occasionally, for example, one can receive feedback from a colleague, for example, a nurse, like, Paul, you didn't write all medications in the discharge note, or Paul, this is something that you could improve about what you did. Or Paul, actually, I really liked your discharge note. It was so spot on and so short, yet everything that was important was in there. So peer feedback, whether it's from peers within the profession or from other professions, or from supervisors, or from near peers, like really near, like same colleague on the same level of studies, can be extremely valuable for increasing self-awareness, for increasing your focus on where you actually need to grow, but also for actually gaining confidence that you actually can do a good job in certain things already. So there, I would say, the more types of feedback you receive from peers and from different ones, so it's not just your friends that try to lift you up, but you know, that it can be from anywhere. The more sources you have, the more trustworthy you can think of the findings you hear. That was the answer.
Yes.
So that's what I think of peer feedback. Peer feedback is a great thing, and you should get as much of it as you can.
Thank you very much for this answer. For now, there are no other questions. I shared all the materials with the participants. So is there anything you would like to add as a conclusion, maybe? Anything else?
Well, in conclusion, there's always space for further learning. For this presentation tonight, I was digging in the literature myself. That's why I could share a nice list of literature. But I'm by no means an expert in the topic that we talked about tonight. So the people that write the papers, they're the experts. And with that, I feel it's an honor to be able to read what they do and to talk about it with you guys. But it's a long way to become an expert. And it's important to know that I'm not an expert. I'm just an enthusiast about this topic. And yeah, I thank you for listening and inviting me.
And thank you very much for leading this webinar. It was really interesting, and you're receiving a lot of praise here in the chat. You can check that afterwards. And also, I would just like to add that to ask the participants to please fill out the feedback form that I shared with them. And also to look at the materials that I shared also with them that are from you. And thank you everyone for participating, especially for Dr. De Roos for leading this webinar. It was really great. And have a nice evening.
Yes, you too. Bye.
Bye.